Today we will discuss the vertebral column. Vertebral column consists of 33 vertebrae, 7 of them cervical, 12 thoracic, 5 lumbar, 5 sacral fused together, and 4 coccygeal vertebrae forming the coccyx. The orientation of the spinal column, as we can see, it is kyphotic on the thoracic area and on the sacrum, and lordotic in the lumbar and cervical region. The classical formation of the vertebra consists of the following parts. This is the body of the vertebra. This is the body of the vertebra, and this is the neural arch or vertebral arch. This arch posteriorly, we call it neural arch or vertebral arch. The vertebral arch consists of two parts. This one here, the one here, this is the site where the arch attached to the body, we call it the pedicle, and the pedicle usually strong bone, very strong bone, and the continuation is the lamina. Here are the lamina. Okay, the lamina fused together in the middle. So this is the pedicle and this is the lamina. From this arch, there is 7 processes. This one, we call it the spinous process. This is the spinous process. These are 2, we call it the transverse process. 2 articulation above, we call it superior articular facets, and 2 inferior here, this is inferior articular facets. The vertebral body and the vertebral arch will form a vertebral foramen. The combination of vertebral foramen will form the vertebral canal. The pedicle is notched here superiorly and inferiorly. Inferiorly, here and here. There is a notch. So when this notch here, this is the inferior, this is the superior, this will form a foramen where the pin is going through. This we call it intervertebral foramen for the passage of the spinal nerves. Each region had a special properties. Each region of the vertebral column has a special property. This is the cervical vertebrae, as you can see here. This is the cervical vertebrae. The cervical vertebrae, there is in the transverse process, there is a foramen here. In the transverse process, there is a foramen. We call it a foramen transversalum. And the spine here is bifid. The spine here is bifid. And the body usually small. The body is small, and the foramen, the vertebral foramen, very large. The superior articular facets here is the superior articular facets, this one, superior articular facets, facing upward and backward. The inferior articular facet facing downward and forward. We have 2 abnormal vertebrae. We call it the axis and the atlas. The first vertebra, this one, we call it the axis. The axis. As you can see, in the axis, just like an arch. It is like an arch, and there is no body here. Okay? Just arch. And there are 2 masses, we call it the lateral masses, for articulation with the occiput and with the second vertebra. This first vertebra, we call it the atlas. The second vertebra, we call it the axis. This is the second vertebra. You can see from the body of the second vertebra, there is a protrusion up, we call it the odontoid process. This is the odontoid process. Articulate with the atlas, and this will represent a body of the atlas actually. This is a very important. This is odontoaxial joint. The seventh cervical vertebrae usually have some criteria. This is the seventh cervical vertebrae. We call it vertebra prominence because the spinous process is long. Usually the spinous process of the cervical vertebrae inclinated downward. As you can see, the direction of them are downward, but the number 7 is backward. The sacral vertebrae, the 5 sacral vertebrae, fuse together to form the sacrum, one bone. And there are an opening here, 1, 2, 3, 4. These openings are called anterior sacral foramen, and posteriorly we call it posterior sacral foramen, where the sacral nerve passes through. The laminae of the lower 2 sacral vertebrae not fuse together and form sacral hiatus. The sacral anterior border of the first sacral vertebrae protrude forward to form sacral promontory. Okay, and the coccyx is a group of 3 or 4 vertebrae fused together. Usually the first one is not fused to form the coccyx. The typical vertebra. The typical vertebra consists of 2 parts. This part is called the body of the vertebra, and this part here is the vertebral arch. The body of the vertebra is round, thick structure, anteriorly carry the weight of the body. The arch, vertebral arch, consists of 2 parts. This part of bone that attached immediately to the body of the